welcome to those who are tuning already. We're not yet having the numbers, but we'll respect our tradition of always starting on time. And it's a pleasure to be here once again. Bonjour, Sandrine.
Bonjour, Elvis. Hello, everyone.
Yeah, your volume is low. Okay. Yeah, good to see you. How was your week?
It was okay. Thank you. Thank you. I'm always happy to be here. And then I look forward to today's topic. It's very interesting.
Yeah, great. And we have Dr. Brian, our co-moderator. Good afternoon, Brian.
Yeah, thanks, Elvis. It was great to be back. I'm doing well. Thanks. It's been a very exciting week. I think turbulent week in every regard, whether we're talking about health or public health. You might be aware that the Lancet Commission released its newest report. So I think there's just been a lot of things going on in global health, in global public health, the pandemic accord, just lots of interesting things that's been happening in the last 2 weeks since we last met. So I think it's just really very interesting times as well. So looking forward to some of the discussion we'll have today.
Yeah, interesting time, really, even with the US politics going on and elections. Most people have already voted, and we're waiting for next week to see what the outcome will be, which will also determine a lot of things in healthcare. Both Republicans and Democrats have different agenda when it comes to global health. So a lot of things will have to change depending on who wins the election. So we keep our fingers crossed. We are we are political, so we don't discuss politics on the town hall. I would like to say hello to, I see Gilbert Mickey. Hi, Gilbert. How was your week? Okay. Well, we don't have Gilbert yet. Maybe if you're talking, you're mute. But I mean, we just want to take this opportunity to welcome you all today. It's a very interesting day for us to go back to a topic we had once had, which was the Give Back Project. And we decided to have this conversation again today to really shed more light on what we mean by Give Back, where we talk about Give Back Project. And last time we had a presentation that was disrupted by, a hack. You remember when our system got hacked for the first time was when we were doing the presentation on Give Back Project. So we thought that it was necessary to revisit this topic, but also to take this opportunity to shine the light on some of those who are doing amazing work back in Cameroon and really just share some of the stories, share some videos, just to let others understand what we mean by the Give Back Project. And when I was discussing this morning with the chair, he actually said it was really important for us to just do some few more presentation of the slides just to remind people of the concept of the give back. But let me give over to the chair to say a word and to welcome you all. Hello, Mono.
Yeah, hello, Elvis and Brian and Dr. Matt Sandrine. Welcome, and thank you all for always sacrificing your time. It's pretty a very stretched week always to get into the town hall and discuss. I just want to thank everyone who was here a week ago, 2 days where we did the breast cancer seminar. We had a huge participation. At least every day we had more than 50 people who were present, and they did give a very good feedback about the concept. So that's something we plan on doing every year in the town hall, and getting other experts, which is part of the Give Back project, which we're trying to give back to our communities in multiple ways that we can. We can do it at form of building capacity. We can do it in a form of multiple other ways, which others will learn about today. So just a big thank you to the whole town hall community. And it's important to remind everyone here that the town hall is a group where we meet every fortnight. We talk about how we can improve on the healthcare system in Cameroon. And it's not just for healthcare workers. It could be for engineers who are planning innovative ideas, could be for gurus in the IT world who are planning on using AI in order to bridge the gap between the third world and the first world countries. I think that's going to be, I was talking with Brian, and we think that's one of the ways which will bring innovation closer. So there are multiple other ways you can really go back and help back in Cameroon and in Africa altogether. But I was very pleased with the participation a week ago, and we look forward to discussing this Give Back project, what it means, highlighting a few people, and then also for Brian, for us to talk about the opportunities, where are the areas of investment that the diaspora can do, and even those back at home, where are the areas of collaboration which we can have with those at home. So I just want to welcome you all, and I hope others join us in this discussion. It's always good to take a pause and have a little reflection of what we're doing as a diasporan group and what we can do going forward. Thank you, Elvis, and over to you.
No, thank you very much, Jeff, for really setting the pace for this presentation. And I'll hand over to Dr. Marthe Sandrine to introduce it in French before we kick off with the presentation.
Hello. I have some technical difficulty, I think. Yeah, I got it. I have two screens and I'm always getting confused which one is on. So, yes, Dr. Mono was mentioning, Dr. Mono a parlé de l'importance de donner, je perds un peu mes mots en français des fois, de donner ce qu'on a, qu'on soit dans la diaspora ou qu'on soit au Cameroun, pour faire avancer en fait l'état de notre système de santé au Cameroun. Et il a mentionné quelque chose qui me touche particulièrement, parce que quand on parle de donner, on pense souvent à faire des missions, on pense à éduquer, mais on ne pense pas nécessairement aussi à donner au niveau du système technologique, parce que les ingénieurs, les gens qui bâtissent des systèmes sont aussi importants que ceux qui fournissent le soin. Surtout lorsqu'on parle des données médicales, on a besoin des ingénieurs, ceux qui ont cette connaissance-là, pour faire avancer la capture ou l'enregistrement des données médicales. Donc, ces personnes un don de leur expertise. Donc, aujourd'hui, le concept, effectivement, c'est de parler de comment est-ce que nous pouvons ensemble, chacun de nous, faire part de cette initiative de donner, Give Back. Je vais utiliser le terme anglais, Give Back, et aussi de voir comment ceux au Cameroun, nous pouvons également collaborer avec ceux qui sont au Cameroun pour faire avancer notre système de santé. Dr. Mono, je ne sais pas si vous avez quelque chose à ajouter. I don't know if you have something to add, Dr. Mono.
No, merci beaucoup, Sandrine. Merci. And we're always happy to have you here so that our platform truly represents what we wanted, being a very bilingual platform. J'ai perdu aussi un peu de my French has gotten worse over time. So merci beaucoup. And we're happy to have everyone here for us to really discuss moving forward. I think, Elvis, we can hand over to you to give us an idea of what a little recap. We'll call it a recap because we've done this presentation before of what really was the Diasporan Project. I don't know if you can put your at the presenter mode, if you can get it to the slideshow. Yeah.
Is it okay?
Yes, that's better.
Okay. Yeah, so as you rightly said, this is supposed to be just like revisiting what we had said before. Last time we talked about the Give Back Project, and we said it's an initiative of the Town Hall, which we are trying to say. A lot of people ask questions several times. We meet every day, we talk, what is it that we are doing? And we said that everyone can do something from anywhere they identify back in Cameroon as home. And we had questions about, what do you mean by my village? What do you mean by where I can give back? We said Cameroon was the topic. So it's an initiative of the Town Hall for Healthcare Professionals aimed at leveraging our expertise as diaspora and focus it on community-based, do things that can be tangible, that can be measurable at the most smallest level and think about. And so we thought about this, the Town Hall Give Back Project, with some few objectives, which we said is good to set so we can be able to measure and see if we are actually achieving this objective of the Give Back Project. And one was to empower healthcare professionals in the diaspora and also those at home, because you can still give back if you're at home. You can be working in Yaoundé and you decide to go to Misaje to do some big healthcare project back there. You'll still be giving back to your people. Sorry, I will have to just a moment. I need to pause some incoming. Okay, sorry for that. I didn't want those disturbance during the presentation. So the second was to utilize the knowledge of diasporans and the resources and their resources to enhance healthcare in villages in Cameroon. And the third was to address the challenges that our local health centers are having back home, and to see how to improve the community well-being of our people. So you look at from this presentation, we are looking at the sub-unit of your Give Back project, which we call it like a village. That village can mean anything to you, right? It could be where you were born, it could be where you grew up, but we want to make it as the sub-unit of where you give back, so that you can easily see what that process will be like. And we said for you to do this, the first thing is to first of all assess the need of your community. It could just be your health center in your village, and you realize that maybe they don't have a weighing scale, or maybe some basic equipment for the hospital that you want to support them by purchasing. Or you might just realize that the midwife need training, and you are a midwife, and you decide to maybe offer some training. But we want to think that you have to do a need assessment to look at the most important thing that you think is important, the gap that you want to fill. And then you inform and design the implementation of your project, and also think about exactly what would be the specific targets that you want to solve, the problem that you've identified that you want to solve. And we thought at the level of the town hall that we could even have a template of a project proposal, which others can just use to draft a small project that they want to implement, and use that maybe to raise funds for their project, or just to help us know how to report on the project by, having a template that they could follow to do the proposal. But we haven't shared that template because we wanted to first of all really see the attraction that people have towards the Give Back project, see what people are doing generically without using any template before, see how we can orientate the concept of the template. But the idea was to make sure that there is a kind of concise, practical way of doing this project that align with how we would want to evaluate the project at the end of it. We also talk about mobilizing resources, and we said we encourage people to either their personal contributions, or they could partner to do some work, or you could even raise funds. And we are here at Town Hall to support you if you want to raise funds for your project, by maybe just giving a support letter that can show credibility to your fundraising. And in implementation, we said it was important, if you are doing a project back home, it's good to collaborate with the local health centers, the community leaders. It could be the chief in your village, it could be the pastor, just collaborate with those in the community so they can help in implementation. And we talked about, and I think Brian will talk a little bit about this, some of the areas that we think that you can really get interest in. It could be infrastructure improvement, it could be capacity building, it could be health education, it could just be provision of medical equipment. So there will be we'll come to think about some of those areas when we share some few examples of people that are doing Cameroon. And we also talk about monitoring and evaluation. If you do a project, how do you monitor to see that this project is really well implemented, and is also being utilized well if it was a project that is going to last for long? And how do you evaluate the success of this and report it in a way that people can see and copy like a best practice? And we talk about sharing your experience and the challenges. There are a lot of people who've been out for so long, they've lost touch with a lot of people back home and the way things are done. You can also just share your experience that can guide somebody on the approach to take to do their Give Back project in a way that will lead to success. So that's why we really encourage knowledge sharing. And one of the ways the town hall wanted to do this knowledge sharing was to capture the Give Back project of each and every member of the town hall and report it on a platform that can be accessible by everybody, or just make sure that we have visibility so people can see what each and everyone is doing and learn from some of the successes or challenges that they had. And that would enhance also collaboration among healthcare professionals back home, and also just promote a sense of community of practice from the town hall, where we can best know how to do things back home when it comes to healthcare. And some of the expected outcome, for example, if you're doing an infrastructure project, you want to see if it has improved the healthcare infrastructure or the facilities. You want to see if maybe it is enhancing physical healthcare resources in the village. It could contribute to maybe just accessibility. Maybe you are constructing a clinic where there is no clinic in the village. That just helps to provide access to healthcare. So there'll be different ways to actually think of how you can actually really see if your project is succeeding. We need to know exactly what is the expected outcome. If it was a capacity building project, you want to ask yourself, is it enhancing the skills of the local healthcare professionals? Is it a training or mentorship program? Or is it just to improve the quality of healthcare delivery? So those are some of the outcome measures that you can have. And there are issues about access. As I mentioned, you might want to think about if you are dealing with issues with access to healthcare. Is your project going to increase access? Is it going to ensure equitable healthcare services across the community? Or is it going to aim at just reducing health disparity in your village or in your region? So if it's about education, some people might want to focus on health education. Is it aimed at improving health education and awareness in the community? Or is it focused on preventive healthcare communication? Or maybe just thinking about some sustainable health outcomes that surrounds every aspect of health education you can think about? And we, as I mentioned, we really would want to encourage partnerships among diasporans. And we said this project is going to go on till 2029. The town hall is here to stay. So we want at some point in time to come back and say in 5 years, this is what diasporans have been able to do back home in terms of giving back to healthcare. And we want to be able to, at that point, quantify the successes of the Give Back project in terms of impact, in terms of dollars spent, and all what you can think about how to quantify this in the next 5 years. So we encourage a very robust reporting system, which Brian and I are working on, to make sure that we can actually capture some of this. A lot of people are doing a lot of things that we have no clue of what they are doing. But if we capture this work, then we can be able to report it in a way that will really show a great impact after 5 years. And of course, there must be some sustainability strategy. How do we sustain the things you do in your village? How do you make sure that the impact lasts longer? And how do you secure more support to continue to do the work you are doing in your village? So they always say that sometimes genuine appreciation is the best form of motivation that you can give somebody. And so the Minister of Health, will be encouraged to give some acknowledgement to anyone who, completes a Give Back project and we report it. There'll be some certificate of recognition, which means a lot for the state to recognize that you've done something in your country. And, just that sense of gratitude that you have that you've done something is important, but we'll also report it in a way that you can have some social media handles that can help you share among your folks to let them know what you've done back home. So this is just kind of a quick reminder of what the Give Back project was. So as I mentioned, it's a unique opportunity for diasporans to give back to their community, to contribute to improve the healthcare system in Cameroon. So I'll stop sharing the slides. And at this point in time, just take a few moments to share some few videos of just what some town hall members are doing back home as far as Give Back project is concerned. Maybe I take Mickey's question before we do the video, just so we have some time where we're going to engage and get questions from you on the Give Back project. But Mickey, I would like to give you the opportunity to ask your question.
Hi, Evis. Thank you so much. Hi, Dr. Fomo. Hi, everyone. Thanks for the brilliant presentation, and I feel so happy that this is already in the horizon with the Give Back project and the work you've been doing in the background with Brian and the rest. I was just wondering if it's possible, as part of the town hall, to organize a session on proposal development for healthcare interventions. I think that will go a very long way to support, to accompany those who are so eager to carry on those small initiatives at the level of the community. Sometimes they have very beautiful ideas, but putting them down in a way that will attract support, will be able to harness some local, national, and international partnerships, I think is very important. So I just wanted to throw that as a food for thought. We might see the need to to have a proposal development session. Maybe why not even monitoring and evaluation the entire project cycle? We can consider to see how we mirror in healthcare interventions within the project cycle, so people can see how they can engage at the micro level with small healthcare initiatives. Yeah, let me just leave it there. Thank you.
That's a very great idea, Gilbert. Thanks so much. And I think our chair is here and he's heard you. We would encourage any expert who has, the expertise on that to, volunteer in the town hall, and we'll create a space for such a presentation. And I think it'll be exciting for a lot of people to just come attend that session to know how to write these proposals for healthcare development projects. So thanks, quite a great idea. Mona, some thoughts around that?
Yeah, I think it's a wonderful idea, and I would hold Gilbert to that. I would hold him to that, and we will talk, Gilbert. So I would send you I think you have my contact, but I would resend them to you so that we can talk about how we can get the right experts to manage this and get things done. Okay, I think it's a wonderful thing.
Great.
I just wanted to, sorry, Elvis, I just wanted to add that just in addition to project writing, I think even just coming up with a grant proposal, how to write a grant effectively and really get grant funding, whether those are coming from the NIH or from the CDC or from the World Health Organization, so the Wellcome Trust, etc. Just the capabilities, really finding that I think sometimes it can be challenging, but if we can have people who have had previous really great experience and success stories in really writing very effective grant proposals, I think that would be really a great value add. So Gilbert, thanks for bringing that up. I think it's a really fantastic idea.
Merci, Brian. Je pense que ce qui a été dit, c'était une proposition d'avoir une session sur comment est-ce qu'on rédige une demande de subvention dans un grant, et aussi comment est-ce qu'on organise son idée de give back, de l'initiative qu'on veut mettre en place. J'aimerais simplement rajouter que ce qui serait aussi très important, c'est d'avoir peut-être pas une session, mais d'avoir un temps de réflexion, soit personnel ou en groupe, pour regarder à la validité un peu de l'idée. Donc, validate your idea before moving forward, either in the proposal development or even grant writing. Ça, c'est extrêmement important. Et il y a plusieurs ressources en ligne qui peuvent aider dans ce sujet-là. Donc, c'est ce que je voulais partager. Merci.
Thank you very much, Sandrine, and thanks very much, Gilbert, as we've all heard from Brian too. It's a very important suggestion. So, as I mentioned, we have a lot of people in the town hall who have done amazing work back home. We have Professor Theodon Gacho, who is with us. We all know the big medical facility that is in Douala called Premier Health Services, if I'm calling it rightly. It's a very big investment back home, and I think we'll have the opportunity to also hear from him. But we're just showing some videos of the kind of work diasporans are doing back home. Even if it's a business, when we say give back, it doesn't mean it must be a charity, right? If you construct a facility like this, which is for profit, it's helping your people because they have an option of where to go get better services. So that's the whole idea about give back. So I would like to take a moment to play this video. Can you see my screen, please? Which screen do you see? Mona?
We can see your screen.
Okay, good.
Hi, I'm Sydney, CEO and the founder of Claire Medical. Welcome to Claire Radiology Boya.
Hi, good morning. I'm Isa, mammography technologist and also ACT technologist.
Hi, my name is Amit, in charge of logistics here today.
Hi, hello, welcome to Radiology. I am Paul, manager of Radiology Boy, your number one medical diagnostic and imaging specialist in the country. We are here to serve you. You're welcome.
Okay, then on smart.
Hi, I'm Dr. Mbakwa, Chief Operating Officer, Claire Medical. Welcome to Claire Radiology Area.
Hi, this is Sydney Taze, CEO and founder of Claire Medical. Welcome to Claire Radiology Medical Plaza, located in Boya in the southwest region of Cameroon.
Great. That was the first example we wanted to share of a Give Back project, and I would want to get some few comments about this example before we move to the next. And of course, as I mentioned, we are going to give the opportunity for a conversation with even those who are doing some other work which they would want us to hear about. Some comments while I get to the next video.
Yeah, Elvis, I think this highlights the importance of us investing in our people. So we could, as Mickey was saying, also just getting projects and writing projects, but putting people together in order to really help identify an area of need, like what Dr. Taze has done. Identify an area of need and see how we can collaborate with partners at home and abroad and really improve healthcare for the local person. That's kind of a wonderful project. And I personally think that these are things that we can encourage and partnerships that we can get together. And I have other seniors here who are doing wonderful things, which we'll talk about. We'll give time for Professor Theodore Gatcher to tell us exactly his experience and also just the fact of how do you put this huge structures together if Sydney is here, and things that we can do as diasporans and how we can collaborate with our partners back at home. Our partners being healthcare workers, engineers, those who want to improve on the healthcare system. And it must not be a huge infrastructure that you're doing. So
did we lose you? Okay.
Okay. Yeah, Elvis, looks like we're not getting you right now. While we're waiting on Elvis, can everyone hear me? Or I'm the one having the problem? I hope not.
Hear you.
No, I can hear you.
Okay. So while we're waiting on Elvis to get things, I just want to get everyone else. Let me give Professor Gatcher the opportunity to really tell us he's one of those who has done marvels back home in Cameroon, and how did he get to, what were the how did he pull that out, and things that we can do in order to encourage diasporans from investing back home?
Yes, thanks very much, Mono and Elvis, for giving me the platform to talk about healthcare investments, particularly healthcare investment back in Cameroon. I think there are lots of people who are doing lots of fantastic things. You know, I've been hearing about Clear Radiology for some time. Unfortunately, I've not been able to visit the center, but looking at the video, it looks really fantastic. And there are lots of other things that that people have been doing. And I think with the current state of healthcare in Cameroon, we will never do enough. I think every investment we do in healthcare in Cameroon is welcome. One of the things that actually I would really like to emphasize is, I think for us diasporans who have seen how things work elsewhere, if we are investing in healthcare in Cameroon, let's try and do something that works like where we are. So if we want to put an infrastructure, let's do something that will mimic what we have where we live on our day-to-day life, so we can give our fellow countrymen, our brothers and sisters back home, the experience of working as if they were in the diaspora. Now, you asked me a question: how do you manage to put such an infrastructure back home? I'm sure I can't remember the name. I think it's Dr. Kaze.
Yes,
yes,
Kaze.
Yes, who's done Clear Radiology. He will equally tell you the first thing is to have the dream. You know, so if you have the dream of what you want to put up, then you can actually work towards it. You also have an idea of what kind of infrastructure you want to put up, and what are your parameters of what you want to deliver. So for example, we put up Premier Health Center in Douala because we want Premier Health Center in Douala to be the same thing you would have if you went to a medical center in Europe or in the US. You know, so if we want to have that kind of situation, then there are certain minimal requirements that we really need to think about. You know, so for example, most people would never think about it, but to have a functioning medical center, you need to have proper power generation. You cannot afford to have downtime with power. You need to have proper hygiene. So you need a clean environment. You need water that will be running 24/7. Those are some simple things that have nothing to do with healthcare. Now, when you start putting machines into a medical infrastructure, it is not sufficient to buy the machines. You need to have people who will actually operate the machines. You need to find people who will actually operate the machines. And those people need to be of a certain standard. So they need to be of the quality that you would like to look after your own patients. So that is another pitfall. You know, you need to have technicians who will maintain the machines. You know, so we know of in Cameroon we have equipment, we have machines that are functioning at an extremely high level. You know, just so yes. Now, if you are putting machines in an environment, you need to make sure that the machines are actually functioning as they should do. You know, so you need to have the technician who will manage the machine, who will repair the machine if it breaks down, And those are some of the things that we have in Cameroon. There are lots of centers that have top-class machines, but the slightest breakdown means the machine is down for months. And so the system actually is deprived of those equipment that they can use. So I think as diasporas, if we want to put some services in Cameroon, we should be looking at how do we mitigate these shortfalls. You know, if we put up a center, we need to make sure that that center is actually geared at providing a service that we are used to in the diaspora. I think most people want to put a service and they look at the profits from the medical service. I will advise anybody investing in healthcare that profit should not be your priority. The profit is likely going to come, but that should not be the priority. I think our priority should be the quality of the healthcare that we're actually providing to the country. If we provide quality service, we will save more lives and we'll gain more patients, and that will eventually bring the profits. Now, talking about investing in healthcare and raising finance, you know, in Cameroon, it's a real difficult scenario. I don't know about you guys in the US, but those of us in the UK, we struggle to raise finance to fund anything in Africa, especially as an individual. Most international corporations that want to fund projects in Africa, they want a government-backed project. Now, what we diasporas are doing, we would rather not have a government-backed project. We want to support the government in achieving its targets, but not a government intervention. So it's difficult for us to actually get finance. And so a lot of diaspora projects are actually self-funded. I would think one way we can actually support those projects is if we come together in financial structures, like, you know, like funds, that cumulative funds for diasporas that invest in healthcare in Africa. I think we'll be able to raise enough money that we might not even need international investors. I think there are so many diasporans who are willing to invest in healthcare, but they don't have this amount of money that can be invested. But if we come together in pooled funds, we might be able to do something.
So thank you very much, Prof. And thanks for that wonderful input about, and congratulations for what you're doing. And we were really here to encourage diasporans and all those to collaborate. I always use the word collaborate with our colleagues back at home in order to advance healthcare. So over to you, Elvis. I don't want to take...
Oh, thank you. I was having some technical issues, and can you see my screen?
Yes, please.
Okay. Yeah, this other video is just another give back project that was done, and the reporting was done by I think the voice you get there is here TV though.
Sha is a local corn-brewed drink produced by the local population of the Ndonga and Matong division in the Northwest region. It is an economic activity that empowers many, especially women. The Misaje Sha Festival, now in its 12th year, has become a celebration of this traditional local brewed drink called Sha. Supported by a non-profit organization, the Unite for Health Foundation, a health institute dedicated to promoting maternal and child health.
The Misaje Sha Festival. So through this festival, we celebrate the culture of selling this locally brewed drink called Sha, which is made out of corn. And we've been doing this for the past years.
The 2024 edition pulled together thousands from all the 12 villages of the Misaje subdivision. Over 100 local women participated in the Sha contest within the festival, producing winners.
With this prize, I will be able to pay my children's school fees and expand my Sha business. This festival has changed my life. I am very grateful to the organizer, Dr. Elvis Ndasi.
In addition to the economic empowerment, the Sha Festival also focused on promoting education. The promoter, Dr. Elvis Ndasi, also awarded scholarship to 25 vulnerable students from the Misaje, Dumbo, and Besa, all in the Misaje subdivision, as well as the distribution of farm tools and inputs to boost local agricultural production. It is a festival of cultural unity and inclusion.
UniteforHealth was registered in the US as a 501c non-profit, and since then we have really scaled up our activities in Cameroon with a lot of focus on Misaje subdivision, where we provide access to healthcare to women and children, and this is through making sure that they have opportunity to give birth to children in the hands of safe healthcare providers.
Apart from empowerment, the Shah Festival was also a celebration of the Misaje's rich cultural diversity.
What's the relationship between Shah and health? That was the question we had when we started Shah Festival in 2013. The whole idea was on hygiene and sanitation. And if you enter any Shah house in Misaje, we have this bucket with a tap that you can put water inside and open using a tap, which you also during COVID. We started it in 2013, trying to promote hygiene and sanitation on this age-old practice that no one can take away. But over the years, that has changed to be more of an economic empowerment activity to these women. And I always say that if you think about access to healthcare, financial barrier is a very big access to healthcare. And any activity you can do to empower women, to empower them to have some economic power, it means they are able to go to hospital, they are able to take their children to the hospital, they are able to take care of their bills, hospital bills. So any of our activity, as much as we provide access to healthcare by organizing outreach campaign, we always spend a lot on the festival by just making sure that we use it as a way to bring these women together and empower them economically. And so that's how the Shah Festival has been in existence for over the years now. Maybe some comments before we get to the next opportunity.
En fait, félicitations à Elvis pour cette initiative. On a parlé tout à l'heure des activités de la diaspora qui sont souvent self-funded, qui sont autofinancées par les promoteurs. Et ça, c'est un bel exemple. Et ça nous rappelle aussi que l'accès à la santé est très, très lié au pouvoir économique que les personnes peuvent avoir. Alors, je dis félicitations pour deux choses parce que c'est lié à améliorer la capacité économique de ces femmes, mais aussi c'est basé sur l'acceptation culturelle, en fait, qui est dans la communauté. Alors, on a parlé tout à l'heure, je pense qu'il y a un intervenant qui a mentionné le fait qu'on doit apporter des solutions qui marchent où on vit, aux États-Unis, en Angleterre ou ailleurs. Je pense que c'est très bien parce qu'on apporte en fait une amélioration de qualité, mais plus encore relié à ce qu'Elvis vient de montrer, se baser sur l'acceptation culturelle. Donc, au Cameroun, on a plusieurs problèmes structurels d'infrastructure. Donc, penser, quand on amène une initiative, de penser quel problème on résout et comment est-ce que c'est connecté avec l'acceptation culturelle. Ici, c'est un bel exemple de faire la promotion, en fait, de l'amélioration économique en se basant sur quelque chose d'existant qui est simplement la célébration des valeurs culturelles de cette communauté. Donc, identifier le besoin, c'est très important, mais identifier comment on va implémenter ça dans les mœurs locales et y aller avec. Donc, ça, c'est félicitations encore. Merci.
Merci, Sandrine. Thank you very much, Gilbert.
Yeah, thank you. Okay, so glad to see the great work you're doing in Misaje subdivision, which is an environment which I've been able to work there for some time with USAID programs on family planning. So I think we have a lot to talk backstage on that. And I just wanted to first of all comment on what Prof. Theodore mentioned, and also follow up with his text in the chat box, that we can grow this platform to a level where people who want to give back will not necessarily require a lot of funding from agencies. And one really quick way is to engage in co-creation of what we want to do. People who belong to the same area, if it is in eye care, if it's in family planning, get together, co-create an idea, an initiative. There is a lot of power in concerted efforts. We're looking at what 3 or 4 people can come together, and that's say in the US, Mickey in the UK. If we are thinking together again to expand to scale what you are doing in Messages subdivision, it's quite easy for us to pull our efforts and do something at scale than individual intervention. So I just want to cue in with what Prof. Theodore did mention, which is really important in resource mobilization. Again, let me just run up by saying that this is one very important way forward for a proof of concept note. Having a track record that this is what you've been able to do at a micro scale with a range of people who have come together, that already is a very big selling point to potential donors in the future. And I think this platform should greatly encourage that. I'm happy that Prof. Theodore is here. I will try as much as possible to catch up with you. I don't know where you are in the UK, but I'll try as much as possible to get in touch with you so we can pull on some other discussions. That's the importance of this platform. Thank you, and over.
Yeah, thank you very much, Gilbert. Certainly a lot can be done when we consider our efforts. It's quite a great idea. And I'll play this last video, and afterward, I'll hand it over to Brian to just talk a little bit more about some of the sectors that, can be very interesting for people to pick up activities or get interested in investing back home or just doing some give back project back in your village. So let me get to this other last video. We are inviting other town hall people to submit their videos or pictures or stories so we can continuously, I think the chair was saying during some of the session, we can always just take 5 minutes in each town hall session to show a video of a give back project. So if anybody has any work you've done, we can always just take a 5-minute pause during the town hall session to shine the light on.
The foundation with a mission to combat maternal and child mortality in underserved communities in Cameroon and Africa.
My name is Dr. Sombong Emil, the director of Messages District Hospital. Today is 7th of March 2024. We are here having a health campaign sponsored by Unite for Health. I want to start by thanking them for this special opportunity given to the population of Messages. For the women especially, those that are pregnant, those that are not pregnant, I want to give them a big thank you for this opportunity. They have been suffering a lot, given that most of our population are not able to afford most of the services that are provided today. These women today have benefited from free antenatal consultation and care, free ecography, health talks, mama kits, and post-delivery kits. All these are thanks to the effort of Unite for Health. I think this is one of a kind gesture. In my 6 years of being here, I've never seen a campaign like this. They have taken care of their bills completely. So we are hoping that this is the start of a good collaboration between us and Unite for Health. We are praying that as I've started, they will not stop here. They will move to other sectors. As you know, we are a new district hospital. We are still lacking in a lot of fields. We need a lot of equipment here. We need a lot of personnel, and we need infrastructure. But we are hoping that with this new development today, we are going to have all these amenities present. We are going to thank the founder of this organization, thank the country president, thank the donors, the sponsors.
My name is Ngong Becky. I want to take this media to appreciate the founders of Unite for Health for the gifts they have given us today. On behalf of all lactating mothers and breastfeeding mothers, I want to appreciate the founders of this program because we've received a lot of gifts and it's going to help us as we will not go to the market for some time now to buy those things they have given us. We want to also appreciate those who came today for the sensitization they have given us. They have taught us a lot on breastfeeding, that's infant and young child feeding. They have sensitized us on personal hygiene, and also they have taught us how to manage the resources we have around for balanced diet. So we want to thank the founders and to appreciate them too. We say God should bless them and open doors for many opportunities to come. And we promise that the knowledge we've gathered here today will educate other mothers who didn't have the opportunity to be here with us today.
For this day, Unite of Health, for this good cinema, I don't bring them for me. I be very happy. So for my first time, I don't do my ecography. I never pay. I don't do so otherwise I pay. I think when I plenty for it gives them most of it the way they send it back my emergency. And I know my belly get 8 months. I'll be ready for God anytime from now. I think when I plenty because I not go buy so any other thing again. I should say if I start level now, I not go get any problem for my emergency back. So I thank the people for Unite Health plenty.
And that was Misaje, March 2024, in prelude to the celebration of the Women's Day. So this activity took place on the 6th and 7th of March. Comments before we hand over to Brian?
Wow, I think, healthcare can be, it's good as we're highlighting multiple other things happening in Cameroon. As I always highlight, you can change lives by the education of mothers like this and help to reduce maternal and infant mortality. This has been a big problem in Cameroon. Our maternal and infant mortality rates are one of the highest in Africa and in the world. So those are the kind of projects that you can partner a lot. I see the partnership with the district medical officer and also with the hospital, which is something to encourage. You don't want to just come in and parachute. Your idea is, I saw that you didn't do it in the community, but you went rather to the district hospital, and that's where it was done. So I kind of encourage that kind of partnership, which is sustainable. The question I would have for you is, how often do we give free things to women, and how do we continue to sustain this kind of model? Which it's nice from the diaspora to come in and maybe do free surgeries. There are multiple Cameroonians doing wonderful things, and we really want to highlight those things. There is Professor Banaye. There are guys who leave the US. They go and do surgeries in Cameroon. There are others who collaborate with already existing institutions and what you're doing right there. So how are you planning on making this sustainable over time?
Yeah, a very great question. And the sustainability on this kind of for this kind of activity has always been something that is challenging. But I think when you build a good relationship with those who support this kind of initiative, and you make it maybe an annual event, when the time comes, they always, when they see the impact of what maybe the previous event was, they can always want to. But it's always things like emergency kits for pregnant women is something that it's very challenging in the village. When you go to the villages, sometimes even when they have the money, they don't even have it to buy. Sometimes the necessary things are already not available in the hospital, dispensary or pharmacy. And so it's a very serious issue. That's why the first video was talking about economic empowerment. When you empower the women economically and they have the money to buy those things, then you've solved even a better problem than giving it for free. So it's an approach that we'd say, if you can solve one problem at a time, that's just how we look at it, solving one problem at a time, and then having the opportunity to just think about a better way to do it in a sustainable manner. So sustainability has always been a challenge for this kind of initiative and effort. Yeah.
Oh, thank you. I would love to share, just before Brian, just something about the COC, which is a center that maybe all these projects I'm not related to. So the COC is one of the projects I really wanted to always share, to know that this exists. This is...
No one should face cancer alone. Cameroon Oncology Center is here to walk your cancer journey with you. We make radiotherapy for your cancer treatment possible, not only in Cameroon, but in the CEMAC region. Get your cancer treated today at Cameroon Oncology Center, situated in Douala, Cameroon, with the latest technology, state-of-the-art equipment, and above all, at less than a quarter of the price you will get from any developed country around the world, offering the same protocols.
Yeah, Elvis, I decided to share just a little bit about the COC because I think they have done a lot.
Just seconds ago, he fatally shot.
Yeah, sorry about that. So just because they have done a lot in oncology, while being an oncologist, I will tell you, if you are in Cameroon and you need radiation, that's a diasporan project, which I think Professor Mobit Wood initiated back home in Cameroon. And they have filled in a gap, which I think we need more investment in. Radiation oncology, it's a huge investment. I don't know exactly how he pulled that out, but it shows us that diasporans can do wonderful things even when the government is back. Because in this same situation, we have L'Hôpital Général, which still has a cobalt machine, which is down most of the time. That's a fact. L'Hôpital Général in Yaoundé, their machine has been bad for a very long time and has not been functional. So far, that's the only institution in Cameroon that has a linear accelerator that is able to help back home. So that's a wonderful thing. So I just wanted to share that project. And I don't think Prof is here. It's not a form of an advert, but it's just for us to know that those services exist, and those services were initiated from the diaspora in partnership with those who are back home in Cameroon. Those are the kind of things we want to encourage.
Yes, and even if it's advertisement for the town hall, if it's a town hall project from a town hall member, we don't mind giving that opportunity for them to be seen and heard, because it's a very important thing. And I'm happy I got the video of Premier Health Services of our own Professor Ngacho, which permit me to play this now.
Attendre? On fonce vers la santé. Premier Health Centre Douala est là pour vous. Ras-le-bol d'attendre des semaines pour voir un médecin? À Premier Health Centre Douala, on vous comprend. Votre santé ne peut pas attendre. C'est pourquoi on vous propose des rendez-vous rapides avec des médecins experts et attentionnés qui vous écoutent et prennent soin de vous. On est votre guichet unique pour tous vos besoins de santé. Besoin d'un bilan de santé? On s'occupe de tout. Un petit souci vous tracasse? Nos analyses médicales peuvent vous aider. Pas au top de votre forme? On vous propose des traitements efficaces. Envie de rester en bonne santé? On vous guide avec la prévention. En plus, notre emplacement pratique en plein cœur de Douala fait qu'obtenir les soins que vous méritez devient un jeu d'enfant. N'attendez pas d'être à plat pour agir. Investissez dans votre bien-être dès aujourd'hui. Programmez votre rendez-vous dès maintenant. Appelez-nous.
Ditch the wait, get great. Premier Health Centre Douala delivers. Tired of waiting weeks for a doctor? At Premier Health Centre Douala, we get it. Your health is no time to stand in line. That's why we offer fast appointments with expert, friendly doctors who listen and care. We're your one-stop shop for all your health needs. Need a checkup? We've got you covered. Worried about something? Our diagnostics can help. Feeling under the weather? We offer effective treatment plans. Want to stay healthy? We can guide you with preventive care. Plus, our convenient location right in Douala makes getting the care you deserve a breeze. Don't wait until you're feeling your worst. Invest in your well-being today. Schedule your appointment now. Call us. Phone number. Book online. Website address, if applicable.
Great. This is another beautiful give back story that we just saw in the heart of Douala, economic capital in Cameroon, and really, really focus on preventive health, making sure that people can actually do their wellness check and stay healthy. And this project is from our own Professor Ngacho, who's been a fervent member of this town hall from the very beginning, who is based in the United Kingdom, but decided to do this work in Cameroon. So there are so many other things. As we say, I'll give the opportunity to Dr. Brian Tegomo just to shed light on some of the thoughts you might have or the different areas you might want to invest in Cameroon. This is the moment to get to do this in Cameroon because the Minister of Health has personally taken an initiative to make sure that they facilitate any diaspora investment in healthcare. If it was difficult in the past in obtaining permits or doing anything, know that this is the best moment you can take opportunity to do something because there is a committee that was created at the Ministry of Public Health just to look over diasporan activities in healthcare in Cameroon. So maybe I hand over to Dr. Brian. Over.
Thanks a lot, Elvis, and thanks for sharing all those wonderful success stories for the Give Back Project and how others have been engaged. A few months ago, we conducted, I'm just going to share the same screen for a moment. We sent out a survey and we haven't yet had a chance to, haven't yet had a chance to, I don't know if you're seeing the screen with my survey link.
Yes, Brian, we can see it.
We sent out this survey, and really the goal really was to conduct a needs assessment. Really, what are the needs? And so, thinking about how can I help to improve the health system or invest, what areas can I invest in Cameroon? And the purpose of this survey really was to curate data on what people see as the most pressing and the most urgent areas that could benefit from investment. And some of the examples that we've heard today has really been really around service delivery. How do we improve access to quality health intervention? Some of the examples from Sydney and Dr. Ngachu and Elvis that shared today really helps in that area. But I wanted to just shed light on a few years ago, the World Health Organization released a document called the Framework for WHO Framework for Health System Strengthening. I just captured one of the figures from that particular document. It's a large document, but they try to delineate some of the areas that could benefit from that could benefit from health system strengthening in general. So it's not just, service delivery. We have lots of needs around just service delivery, which we've heard about. Workforce development is critical. We really have to increase our pool of competent, responsive and productive healthcare workers. So the quality of the healthcare providers that we have in our system is critical. So I really applaud you, Dr. Mono, for the work that you're doing and doing capacity building, the workshop, the seminar you organized that on breast cancer, a lecture. I think that was really impactful as well. So that kind of training that helps to really vitalize our health workforce is really critical. We have other things like health information systems. We know this is a critical time for information technology. We're seeing how AI is rapidly changing how we approach healthcare, how we are living in the fourth industrial revolution. I think we're going through that phase now, and I think it's a critical time to invest in health information technology and things like that. We've seen the importance of medical products and vaccines and how critical that is. I think the last 4 years of the pandemic has just highlighted how critical it is for us to build the kind of technology that enables us to be able to, or be in the capacity to deploy some of those technologies in real time, whether that's building PCR machine, whether that's building diagnostic assays, therapeutics, vaccines, etc. So being engaged in those areas is a really critical component. I think Dr. Ngacho talked a little bit about finances, which is really important. Raising funds really in health can be really, really critical, and I think that's a very important area to invest in. and leadership in general and governance. So those were some of the key elements that that the World Health Organization had tried to kind of frame those big subjects into sort of buckets. So really thinking in that sense. So when we did this survey, and I'm going to try to drop the link in the chat for the survey, we will try to, we haven't had a chance to share the results here. We've had a preview of what the results looks like and what the trends looks like, but we haven't yet had a chance to share those results here in the town hall. But I hope we will be able to do so in the next coming weeks. But we've been trying to curate as much what you all think are the most urgent and the most pressing needs. What are some of the areas that you think could benefit from? And I really appreciated one comment that Dr. Ngachu made a little earlier. He said, if you've seen something that you were in the diaspora, you've seen something that works well, something that is impactful, works very well in the US or maybe wherever you are in the world, and find ways to give back or to transfer that technology or that knowledge or that skill back in our home country. And I think in any capacity can really help to really change systems. So I really would like to encourage all to, I'll try to put the link to that in the link to the survey again in the chat for those of you who haven't yet had a chance to complete it. But it's really going to help us to have a sense of where you see the greatest opportunities for in terms of needs, in terms of areas where we could potentially really leverage our efforts. That would be really helpful so that we have a sense of how to curate things moving forward. So Elvis, that's what I really wanted to share. I just wanted to share that in that framework, that we shouldn't only think about this in terms of service delivery, but also other areas as well, whether that's research, other things as well. So that I think there are lots of other areas that could benefit from significant investment, which we haven't really touched on. Over.
Thank you. Merci, Brian. I think ceci était vraiment très, très informatif parce qu'on parle ici d'un formulaire de besoins, de validation des besoins. Donc, Brian a fait en fait le tour de ce formulaire qu'on vous demande très gentiment de remplir pour informer sur les besoins que le Town Hall ici peut répondre. Particulièrement les besoins au niveau de la délivrance de services, mais aussi d'autres secteurs. Et Brian a fait le tour de mentionner effectivement que par la délivrance de soins, il y a aussi des besoins au niveau des finances, il y a des besoins au niveau de la technologie de l'information, donc les systèmes. Il y a besoin au niveau de fourniture d'accès, on parle des vaccins, des médicaments. Mais je voudrais souligner, quand on parle de besoins, on parle de validation de besoins. C'est très important quand on veut lancer un projet au Cameroun ou ailleurs de valider ce besoin-là. On a parlé d'approcher le GIVEBACK, cette initiative, en se basant sur ce qui marche bien autour de nous, là où chacun de nous vit. Mais ce que Brian vient de nous démontrer, c'est très important de comprendre quel est le besoin qu'on veut répondre, auquel on veut répondre. Alors, essayons de faire l'effort de suivre ce que Brian vient de nous démontrer, c'est-à-dire faire un need assessment, faire une évaluation de besoins avant de se lancer dans quelque initiative quelconque. Et le Town Hall, je pense, est une place merveilleuse pour ça, parce qu'on a l'occasion d'entendre des experts, on a l'occasion d'entendre des personnes qui ont fait le chemin, walk the talk, comme Sydney Taze et bien d'autres encore, professeur Gachou, dont on peut apprendre d'eux et aussi tirer des leçons sur les besoins qui sont encore en suspens et qui ont besoin en fait de solutions sur le terrain. Merci.
Thank you, Dr. Sandrine, for really putting it eloquently in French. And we would continue to open the floor now for conversations and discussions, ideas, and that's it. Chair, is it okay to open it for conversation?
Yes, it's okay. And I would love to highlight, there's one of our very fervent participants, Dr. Samuel. And Samuel had presented, I don't know, those who were, if you're not here, wonderful project he's doing back in the Northwest region. And I don't have the videos of that. I was looking for online, I didn't have it, but it's just things like that So people like Dr. Samuel, they for the past 10 years, they have had investments where they have created health centers, and they have also helped in building capacity, education. I've participated about 5 times in his town hall and conferences he does with the local women in Dub, where he has, that's Grace Garden, yeah. So that's Grace Garden Dub, which she has done wonderful things before. So those are all things that we should be able to encourage and get diasporans together. As Brian eloquently put it, giving back is not only about building infrastructure, it's about education. It's about helping the government in order to build the right framework where we can actually provide better healthcare. You can do consultancy as a diasporan. We have our Cameroonian diasporans who are consulting for the US government. You can't believe that. And how do they leverage directly? I know Cameroonians, I don't want to quote names here, but I know Cameroonians who are found in the Biden administration's team to deal with pandemics. Multiple Cameroonians in that team. I know about 2 of them. So those are all things you can also give back to your country, but the country needs to be able to accept and also want to receive from you. So there are multiple ways of giving back. And really, Brian, I love the way you eloquently placed the slide in the different ways where we can also contribute and give back to Cameroon overall. Elvis, we have, yeah.
Thank you for really highlighting the work of Dr. Samuel. He's one of really fervent participants in the town hall who's doing really great work. I would like to, and as I mentioned at the beginning, it doesn't need to be this kind of big project. It could just be, providing your health center in your village with just some few blood pressure curve meters and some, weighing scales or things that are lacking. We just mean that give back should not be looked at that it must be at a very large scale. It should be as, basic as just solving a problem you've identified in your community. And we would really want to emphasize on just making sure that the town hall knows what is being done so we can shine light on it and capture the impact on the data. So over to anyone who has some thoughts around the Give Back project or questions. One of the, our chair has always emphasized on this. As far as the town hall is concerned, from the beginning till date, we have never raised any funds as a town hall. We don't want to deal with anything that has to do with money. Everybody in the town hall volunteers, and we want that if there is a project, people should do their project by themselves, raise their funds by themselves. All we need is just a report of that project so we can shine the light on it. And I know we had a question last time, why can the town hall not come together and do a project? We're just avoiding to have anything that will have to do with managing funds or money. We want to just be a zero money organization, and it's been effective for 3 years. You see that you can do a lot with no money, and we're doing it with no money. And I think that this is the kind of work that we think we can do to your time. You come here every week, and no one is paid to attend this session, but there are people who don't miss a session of the town hall. I have personally learned a lot for the past 3 years by just being here every fortnight and listening to people speak, experts speak, and it's been a great university for me. I'm sure Mona, you too. We all have learned a lot from the amazing presenters that we've had on the town hall. You're mute, Dr. Mona.
You can't believe it, but truly, you can't stop learning. You will not be amazed each time you come here with experts. You can't stop learning, and you cannot stop learning from those who are back home too. So we've been 4 years where we have shared knowledge. We have learned a lot. We have grown. And one of the participants always tells me that each time he wants to understand what's going on in Cameroon, he dials into the town hall. And you get to understand what the health professionals in Cameroon are going through, what innovations they are making. And we want it to be a platform where we can really collaborate, create a sense of ownership for those in the diaspora and those back at home, so that we can understand the healthcare. You can never change something you don't understand. The best way of changing things is using those who are there in order to help you build a solution for the problems that they have. We don't want parachuting solutions back home. There are a lot of things that we may want to do as much as they are done in the US, but there are cultural differences. Just look at the project, the SHA. Just taking SHA as a platform in order to empower women and actually bring them healthcare is an amazing idea. There's no other way of doing it if you don't understand the culture of the people. So I think that's wonderful. Elvis, I was trying to shop a little bit about what Samuel is doing, and maybe with time, I may be able to highlight some of it. I think I can. I've gotten some of the videos, so. Now you are muted.
Great. Yeah, I think we'll give you opportunity to share that so we can also see it's very important. There's a question on the chat. How can we incept healthcare electronic data management in Cameroon healthcare system, government and private sector? I would say that the first very important step is to approach the Ministry of Health and know what they are doing, because I think there can be a plan, even if it's not being implemented, so that your work can fall within that national strategic plan. I just shared a document in the chat, which is the MinSante National Digital Health Strategic Plan. If you look at that document written by the Ministry of Health, it can provide some guideline on what plan the ministry has as far as digital health is concerned. But I know that they have to learn from the mistake that the United States made by making sure that they think about interoperability as they start to implement the electronic health system. Because I think what is happening now is still doing some silo work, where some hospitals are doing what they want to do and the others are doing what they want to do. If they can think from the very beginning how to have a plan that will integrate, the different systems that they are using, it will be really great. But I think if you approach the Ministry of Health, they have a division there in charge of IT and digital health. I think there is a department there that can answer these questions. I would encourage you to reach out, and if you have any challenge, please let us know so we can also redirect you to the right people.
Yeah, so if there are any questions so far, then we can always talk about it. I've not succeeded in having the right video that really showcase what Samuel is doing at Grace Garden. So it's been a bit difficult.
Okay. Yeah, that's right. We'll continue to look for that, but while we open for any other questions that we have in the hall.
Are there any other diasporans that you may want to highlight who are doing wonderful things? I do know so many of them that I cannot even call all by name right now. Some of them I know.
Hello.
Yes, please.
Good evening. Sorry, this year I've not been regular on the town hall. I'm so sorry. And this evening I said today I must attend, and yet I came late. So I'm excited to see the same people that are really doing great work in Cameroon. I just want to congratulate you all for the great things you are doing, and to say that we, in our small way, we are doing great strides also in the local community. Especially this year, we've been able to do some work on basic literacy. The community where we work with out-of-camp refugees and the less privileged, and we realized that the literacy. Also, we did some basic literacy with them in June, July, and some back to school, books. We paid school fees this year for about 50 children and give them back to school. And their parents also, we had to empower them to start doing something so they can help. So we had to identify their needs and give them some startups to start doing something. And it's interesting that we are following them up to see how they can save little money and help their family. So we are doing little work, but we are getting there gradually. And also the health issue in the community where I work, the women don't go to the hospital, especially the out-of-camp refugee. They deliver at home. From July till now, I have 5 women that have delivered at home. The last one is about 2 weeks ago. She delivered alone in the house without even assistance. Some do have assistance. So it's quite challenging, but then we're moving on. Thank you very much.
Oh, thank you, Francoise. It's always good to see you. And for those who don't know Francoise is a nurse practitioner back home in Cameroon. And she's that's why you must not be in the diaspora. There's so many wonderful people doing wonderful things. Francoise is a big philanthropist and does a lot in sickle cell. And congratulations to Yahuba, Francoise, Elvis, and those for the new paper that came out in sickle cell situation in Cameroon. And continue the wonderful job you're doing. You've been part of the town hall since the conception, and you have done a presentation on sickle cell walk, sickle cell day. We talked about that, and we want to encourage you to continue what you're doing. So Francoise is one of those who is back home, not in the diaspora, but collaborating with a lot of diasporans and getting a lot of things done. So I'm happy to hear the project you're doing for refugees, and continue the wonderful thing you're doing for sickle cell patients back home.
Yeah, it's really heartwarming, Francois, and I'm happy you say that. Sometimes people think it's a joke when you tell people that in this age of time, women still give birth unassisted at home in Cameroon. And delivery at home is still about 40% in Cameroon for those who don't know. That's the statistics. So it's a big problem. So that's why each time I hear of any work that is helping women give birth in the hands of safe healthcare provider, it's really a great thing you're doing. Really great job. Any other thoughts around the Give Back Project? Those are the kind of stories we want to hear. Yeah, Dr. Yoba was supposed to present another project that one of his friends is doing in the West region, constructing a health center there to help the people. It's a very important project too, but we've not had he sent some pictures, which I'll try just to maybe share the pictures. It's really not showing well. I cannot rotate the picture, but I'll just try to share. This is another diasporan doing this construction of this health center in his village, in the West region. He's not sent me the exact name of the village, but it's a very good project. Village. Yeah, so we're just showing this to show you that it's doable. See, this is a beautiful structure in this village. So I think that projects like this should be well captured. We are going to capture the story and tell it better next time we meet. But it's a very beautiful structure, almost completed. I knew when this project started, I'm amazed at the speed at which it has gone up to this point. So great work, a lot of great people, interesting work going on by diasporans. Like this is still the structure. Yeah, that's it.
Yeah. Okay, Elvis, I just wanted to share with, I didn't have the right video, but for those who know Dr. Samuel Injiter, he has a foundation back in Cameroon called Faith Garden Mission Foundation. And they have been doing a wonderful job in Cameroon for the past more than 10 years. And you can see they organize. I have been a presenter at their town halls about 3 times or 4, where we give education to women and in local lingua, in the dialect, and also on all topics you can imagine. So he has a health center in Dub, which is huge health center in Dub, and collaborates with the government and is able to do screening for sickle cell patients, breast cancer awareness. He was very involved in that. They were very involved in cervical cancer screening, which is the second most common cancer in Cameroon. He works and uses telemedicine in order to diagnose cervical cancer. So just wanted to highlight him, and he has wonderful videos about what they do, but he is purely philanthropic, and this is a self-funded effort. So it's just highlighting a few of those Cameroonians that are doing wonderful things back home, and we want to encourage everyone. And Elvis, I would love to, from last Saturday, when we did the education on breast cancer, we got a lot of good feedback. And we're planning on putting together a team of diasporans, both in every field in medicine. It could be looking at those who are involved in information technology in healthcare, those who are involved in clinical sciences itself, where we can go back and provide education, which are also accredited lectures where people can get credits and be able to provide that directly to medical students, to nursing students, to pharmacy students, to public health students, because we have a lot of experts back here. And I trust me, last week, the feedback was one of the best feedbacks I've ever had, giving a lecture back home, and was attended by oncologists who are here in the US, and a lot of people felt there was value to that. So I think it's something we can put in a team as a town hall and be able to do it in person. If you're part of the diaspora and you're an expert in your field and you're traveling to Cameroon, you let us know. Boya University is willing to collaborate. The medical school in Boya, they showed a lot of interest, and we can always put you in contact with some of those faculty members, and you can always deliver a live lecture, or we can always arrange for online lectures where you can give back in that way. So there are multiple ways of giving back, Elvis. You're muted, Elvis.
Okay. Now, sorry, I was talking about that if you also have an opportunity to do any work, and you can always share in the town hall, and people can know where you would raise funds to do that, and they can always guide you as well. Oh, sorry, I'm doing something wrong. They can always guide you to tell you how to, where to go to raise funds. So we should be more a resource group as well to each and everyone, and see how to help each other. This is a project that Unite for Health. Oh, there is a poor transition. I didn't mean to have this kind of transition. Sorry. That's not what we wanted. This is a project that Unite for Health wants to do in Dumbu village. This is a maternal health clinic in the village in Dumbu in Mr. J subdivision. They are raising funds to do this project there. And if you can be part of it, that would be great. It's really going to be a very great facility there to provide all the services you find on the screen. This is the block construction plan, and with very basic, but it's going to be basic, but will meet up with all the standards you can find in even a developed country. So you're going to get the post delivery room, you have labor room, you have surgical room, you can do cesarean section in that facility in the village in Dumbu, where there is currently none of such facility. We hope that by the time we finish with the project, we will be able to solve a big problem. This is where women can sit and receive antenatal health lectures. We want to still maintain our culture and receiving lectures. So it's going to be self-sustaining with a water borehole and solar panel on the roof, so they can connect to Starlink and have internet to provide solution from diaspora in case somebody needs to consult and refer to an expert in diaspora. So it's going to be a very self-sustaining facility with all these solar panels. So this is a project. Look at where it is. That is exactly where the project is going to sit, in the village there in Dumbo. So they deserve the best as well, right? No matter where you are, you deserve healthcare. So this project is ongoing in terms of fundraising. Unite for Health will be having their fundraising gala on the 5th of December to start this project. And so if anybody is interested in being part of this initiative, please, you can always contact us and tell us how you want to be part of it.
Wow. So I think if we have any other member in the town hall who has some ideas and how the diaspora can really give back.
If not, it's been a great day. We are at 2:30, and if there are no other thoughts, maybe Sandrine, you want to close the session with a summary?
Before Sandra, I just really wanted to thank the team that wrote the paper on sickle cell. I see Francois is here as well. I think that was really great to try to, because we've talked a lot about sickle cell and the problem of sickle cell in Cameroon. I just put the link in the chat for those of you who didn't see this publication. Just try to share my screen just briefly. So I just wanted to, I know you sometimes don't like to take flowers, but I think it's really important. It's a really great publication that came out last week. And I think you can see Elvis and the team there, Dr. Yauba, Pulmono and all that. I think this was really great to really identify a question or a research question or priority, because we don't really know so much about the epidemiology, a lot about the dynamic, even though the data for this study specifically came from the Full Health District. But I felt that they did some really insightful work. This is the first time that I've really seen a very good summary report of what the real issues and challenges are. And the way they concluded the paper, which was really interesting, was they were able to identify some areas that could benefit from improvement, like routine screening. They made some recommendation here for the importance of just routine screening, the importance of infection control and prevention measures. They talked about community engagement, which I thought was really critical and important, workforce, health workforce capacity building. So I think overall it was a really great paper, and I really wanted to thank you, Dr. Francois and Elvis and the rest of the team that came together to put together, identify the problem, a research question that we didn't really have a good answer to, and we're able to put together a team to address that question. So really, I think that's really great. And this kind of initiative is really great because it really helps us to see where there are gaps. And it really helps policymakers to better strategize in terms of resources. What are some ways that resources can be allocated to resolve that problem? So I think what you've done is, even though it was restricted to the Full Health District, I think it's just a microcosm of what's of the picture in Cameroon, but also in Sub-Saharan Africa, particularly in areas where malaria seems to be endemic. I think you made a point in the paper that the Full Health District has a high malaria endemicity. I think if I read that right, but I think that was really powerful. So it's really a microcosm of what we see in most of Sub-Saharan Africa, where malaria might seem to have a high endemicity as well. So I think that was really really powerful. I just wanted to congratulate you and work and to get a really impactful paper. Over.
Yeah, thank you very much, Brian, for your kind words.
Thank you.
Yeah, very humble. When you describe interviews, maybe when we transcribe some of the interviews from those kids, some of the statement was really heartwarming to hear a little kid say, when I'm in school, my friends laugh at me and say I have a big head because there are always veins passing on my head. Some very heartwarming, quote that we think this problem is a very big problem, that much has to be done. So really, thank you so much, Brian. Right. So Sandrine, on est arrivé.
Can I say something?
Yes, Francois, you can say something before.
I want to say that this paper was made possible through Dr. Foma also, that puts us in contact with Chai, and they helped me to where some of the work I've done has been lying. And I want to really appreciate you, and he published many other papers from the work that was done. And we're able to analyze that work, but many other papers can be published from that work. And so we are still seeing how to get into that. So thank you, Dr. Mona. It has really come through. You have always wanted to see that the work I'm doing should not remain lying in the cupboard somewhere. And this is just the beginning. So thank you very much. And the team was a wonderful one. Sincerely, thank you for putting us in touch with Dr. Yauba, Makia, and the other team members. It's amazing working with them.
Yeah, thank you. And trust me, as Francois said, Francois has data, years of data on sickle cell, which our goal before doing this was that we should not allow this data to rest. We have to publish it and get others really engaged. And we love the collaboration that took part in getting this first paper go through. And we are looking forward to having more qualitative data published in the future. And we're looking to bring back the team together and so that we can get a lot more understanding about the state of sickle cell. So Francoise, as I said in the beginning, continue the wonderful job you're doing for sickle cell and the wonderful job you're doing also for those in the refugees. And we cannot stop thanking Dr. Yauba and the Clinton Foundation and the initiative for their engagement in Cameroon, both at the government level, because you need to have a dynamic leader in order to get things done, both at the level of the central level. Even the national plan for cancer fight against cancer in Cameroon was initiated by the Clinton Foundation. Even the access to oxygen right now in Cameroon, access to chemotherapy drugs, which we have. We also have a paper which we've been delaying on breast cancer, which I think I've been delaying it a lot. I've not been having time to work on it. But there are many other things. When you have a great leader who thinks about his people, we can actually create data and drive resources towards those things. So our goal is to drive resources towards sickle cell. Our goal is to drive resources towards cancers. Our goal is to drive resources towards healthcare problems that are existing in Cameroon. So thank you, Elvis and Dr. Sandrine. Matt, over to you for us to close the session.
Is Sandrine? And any last words? Okay. I'm sure Sandrine might have dropped off. Brian, any last words?
No, thanks. I think that it was great. It was great to reminiscent some of the success stories that we've had, and also discuss about some areas that could benefit from additional investment. So I think that was great. It was just great having this conversation and having the inputs from others as well. So thanks a lot for the discussion and everything. Over.
No, thank you very much, Brian, and thank you to our chair for your leadership and for keeping the team together. Thank you, Dr. Matt Sandrine, for co-moderating, and I want to thank everyone who has taken part in the session. Thank you very much, Gilbert Mickey, for your participation and for all the great suggestions. I see we have Forty Louis and James Thomas and Can. A lot of people who have stayed up to the last part of this presentation. I want to thank you and to say, please know that the town hall is every 2 weeks. Even if we delay at times, because we do delay at times in sending out the flyer to tell you about the topic, but just know that even if you don't hear about the topic, there will be a topic. You just come and attend, because we will do our best not to skip any session unless there is really some really serious events which we've not had in the past 4 years. So please see you in the next 2 weeks, and we are going to communicate the next topic for our next session. So thank you very much, and I wish you a nice weekend. Unfortunately, we might not have the jingle. I have a technical issue playing the jingle, but
I can play it, Elvis.
Okay, great. Yes, you can play it from your end. So thank you so much, and wish to see you again in 2 weeks' time.
Yeah, just